99, 100. Oh, hey there. You just caught me wrapping up my physical activity break at my office. Welcome to the South Carolina FitnessGram Supporting the Health of All Students concurrent session. I'm Erica Ayers, the school wellness consultant with the Division of Nutrition, Physical Activity, and Obesity Prevention, and we are with the South Carolina Department of Health and Environmental Control. I'm also the Executive Director for the South Carolina Governor's Council on Physical Fitness, and we're excited to be a sponsor for this year's Leadership Summit for Healthy Communities Plus Youth Edition. Now, before I present our speakers, I want to tell you a little bit more about my division, DNPAO. We improve access to healthier foods and opportunities for daily physical activity through policy systems and environmental approaches. This includes providing subject matter expertise and guidance on creating healthier school environments using best practices for nutrition and physical activity. For example, we coordinate the South Carolina FitnessGram system, a statewide, web-based, health-related fitness testing and data management system to enhance the ability of public schools to monitor and improve student health. Now, student health is an integral part of building a foundation for good health and lifestyle choices. Since 2014, the South Carolina FitnessGram initiative has focused on evaluating and improving health-related fitness among public school students in South Carolina. The latest data from the 2019-2020 school year report provides insight into components of fitness that are known to be related to health outcomes in children and youth. Today's speakers are Dr. Russ Pate with the University of South Carolina and Breonna Milling, my colleague, with the South Carolina Department of Health and Environmental Control. I hope you enjoy learning more about South Carolina's efforts to improve student health.
All right, thank you so much, Meg. Welcome, everybody. And also thank you, virtual Erica, for a nice introduction. Okay. So my name is Breonna Milling, and I'm the South Carolina FitnessGram coordinator for at the Department of Health and Environmental Control. And I work in the Division of Nutrition, Physical Activity, and Obesity Prevention. And this is Russ. You can introduce yourself, I'm sorry. Can you hear me? Am I unmuted? I apologize if I'm not. Okay, well, I'm gonna keep going. And this is also Dr. Russ Pate. He's also a partner in this FitnessGram project. And so just to go ahead and get us started, today we'll be presenting a little bit on the FitnessGram initiative. And this is a statewide system that we've had in place for a little while, and it also provides insight into the data that we have collected through the system, and it can be used to support student health and schools and community. And so feel free, if you have the capability, to in the chat box, let us know who you are, where you're from, what you do. That'd be great. And so to advance us forward, so some of you may be unfamiliar with FitnessGram, some of you may be coming to get a little bit better understanding. So FitnessGram is an assessment tool that was developed by Cooper Institute to measure student physical fitness levels. And so South Carolina has had a statewide system in place since 2014, which was made possible through funding through Blue Cross Blue Shield of South Carolina Foundation. And a few others who have partnered with us in this initiative are the South Carolina Department of Education and the University of South Carolina, who each play a role in facilitating the data management and evaluation. Okay. And so South Carolina FitnessGram, it's a statewide web-based system. And this is for health-related fitness testing and data management as well. And so the initiative involves the aggregation of health-related fitness data from the public schools who are participating and using this software. And so this provides schools with the ability to monitor and opportunities to ultimately improve student health. And so we've known for a while how active, or not really how active, students in South Carolina are. But until this system was in place, we didn't really know how this was impacting their health. And so the FitnessGram system now provides us with this information. And so currently we have 72 districts who are participating, which is over 1,000 schools in this effort. And so what Russ is going to do right now is go into more details about the project, the logistics and the findings. And then we'll transition back to me and we'll talk a little bit about the software system and the direction that we're headed in. Okay, so I'm going to stop sharing my screen for a moment and we're going to transition to Russ's screen and then move back to me. Give me 1 second. Okay, Russ, you can share your screen.
Okay, well, thank you, Bree, and it is a pleasure for me to have the opportunity to speak with everyone today about the South Carolina FitnessGram project. I'm with the Arnold School of Public Health at USC, and it's been our pleasure to work with colleagues at DHEC and the State Department of Education and Blue Cross and Blue Shield of South Carolina in implementing this important project. What I'll be doing over the next few minutes is providing some background on the South Carolina FitnessGram project. I'll outline the logistics of the project, how we've gone about collecting and managing the data that have been generated. And then I will summarize some of the findings from the 2019-20 school year iteration of the South Carolina FitnessGram project. So FitnessGram is a very well-established physical fitness test battery. It is by far the most widely used test battery across the United States. It's been in place for several decades. It is intended to be a measure of so-called health-related physical fitness, and the components of health-related fitness are known to be cardiorespiratory fitness, weight status, muscular strength and endurance, and flexibility. The test items that are included in the FitnessGram protocol and those that are used in the South Carolina FitnessGram project are the PACER test, which is a shuttle run test of cardiorespiratory fitness. Height and weight for calculation of body mass index is the measure of weight status. A trunk lift test is used to assess trunk strength and endurance, curl-ups for abdominal muscle strength and endurance, push-ups for upper body strength and endurance, and then a sit and reach test of low back hamstring flexibility. The kids' performances on each of those test items is interpreted using so-called criterion reference standards, and those are standards of performance on each test item that are linked to health outcomes that are known to be associated with each of those test items. And 3 criterion reference categories are applied. And so each child's performance on each test is rated as falling in the healthy fitness zone, where we hope they will be, in the needs improvement category, or in the health risk category. So kids can fall in any one of those 3 categories on any of the test items. In South Carolina, the statewide administration of FitnessGram occurs in participating school districts for 2nd, 5th, and 8th graders, as well as those in the high school grades. The tests are administered ordinarily during physical education classes by professional physical education teachers. The data that are collected and entered into a computerized system by the teachers are managed ultimately through South Carolina Department of Education Power School data management system. And then ultimately the data are compiled by the South Carolina Department of Education, transferred to our group at the University of South Carolina for summary and analysis each year. And so The most recent year for which the data have been compiled are the 2019-2020 school year. And I'll now take a few minutes to summarize the findings from that year's worth of FitnessGram data. We're fortunate that we have excellent participation in this project in school districts across the state. As you can see, for the 2019-20 data, there were 53 participating school districts, 475 schools, and data were available for over 63,000 children. As you can see in the state map there, we have a good distribution of districts and schools and children across the major geographic areas of South Carolina. In terms of the characteristics of the kids that provide the data, and again, there are over 63,000 of them in this particular year's data set. You can see that there's a reasonable distribution across grade levels. The largest percentage is for fifth graders. We have substantial percentages at second and eighth grades, as well as high school. About equal numbers of boys and girls provide data. And then the distribution of race ethnicities is 52% white, 30% African-American, 12% Hispanic, and then 6% in other. And about 58% of the sample are kids that are rated as living in poverty. About 42% do not. Now I'm going to summarize the findings for cardiorespiratory fitness and weight status. For cardiorespiratory fitness, the primary test used is the PACER test, which is a graded shuttle run test. A small number of kids across the state do take the mile run test, and the data for both of those are collapsed into the healthy fitness zone categories. And you can see that about 50%, about half of the sample at fifth grade, eighth grade, and high school fall into the healthy fitness zone. So that's the glass half full interpretation. You can see that about a quarter of the sample are in the needs improvement, and another quarter of the sample fall in the health risk category. So about half are where we would like to see them, and about half of the sample fall below the healthy fitness zone category. I'll mention that for second graders, only the weight status data are collected and managed, although the kids do practice the other test items as second graders. Staying with cardiorespiratory fitness, the breakdown by gender, you can see that a greater percentage of boys than girls fall in the healthy fitness zone, and that if we further break the data down by grade level, race, ethnicity, or poverty status, that those gender differences hold up across the subcategories, and that's true for poverty status as well as the other categories. And to summarize the findings for 2019-20 for cardiorespiratory fitness, the key finding is that just half of South Carolina students attained the healthy fitness zone, and the following patterns were observed. A smaller percentage of girls and boys attained the healthy fitness zone. The percentage of students attaining the healthy fitness zone was lower in Black students than in white students, and that those trends were more pronounced in girls than boys. The percentage of students attaining the healthy fitness zone was lower in students in eighth grade and high school compared to fifth graders, and the percentage of students attaining the healthy fitness zone for cardiorespiratory fitness was consistently lower among students living in poverty than those not. For weight status, we find that in the overall statewide sample, just about 2/3, 62% of kids fell in the healthy fitness zone. About 21% were in the health risk, and 17% in the needs improvement category. You can see the percentages attaining the healthy fitness zone were in the 60 to 68% range across the grade levels. Again, if we break this down by gender, you can see that the patterns hold up, that about comparable percentages, a little over 60% of both girls and boys attain the healthy fitness zone on weight status. And those comparable percentages hold up across the grade level, race, ethnicity, and poverty status categories. So our key finding for weight status is that about 2 out of 5 South Carolina students are overweight or obese, and that the rates of overweight and obesity are high and too high, and definitely warrant intervention and attention through all the channels available. The percentage of students achieving the healthy fitness zone was similar in boys and girls. The percentage of students achieving the healthy fitness zone was lower, though, in African-American students than Hispanic students, and that the percentage attaining the healthy fitness zone was higher for second graders than the other grade levels, and the percent attaining the healthy fitness zone was lower among students living in poverty than those not. Also provide just a quick overview of the findings for the other test items included in the FitnessGram protocol. You can see that for upper body strength and endurance, about 57% of kids attained the healthy fitness zone, 68% for abdominal strength and endurance, 77% for muscle strength and flexibility in the trunk, and then low back hamstring flexibility, about 70% attained the healthy fitness zone. Also, because data are available on a statewide sample and excellent quality of data, a large amount of data, it's been possible for us at USC to undertake some research-oriented analyses of the statewide FitnessGram data. And we have done some work looking at poverty status as a moderator of the relationship between cardiorespiratory fitness and academic achievement. I express my gratitude to colleagues at the State Department of Education for making academic achievement data available to us to undertake this sort of analysis. But obviously, the great concern is that we should do all we can to support kids' academic performance. And as I'm going to show you in a second here, enhancing their fitness appears to be one way that we can do that. So these are a summary of our findings for attainment of English language arts academic standards. And you can see 5th graders on the left, 8th graders on the right. And then we've looked at the odds of attaining the healthy fitness zone categories based on poverty status. And so you can see that for both 5th and 8th graders and for children living in poverty and those not, it's better to be in the healthy fitness zone for cardiorespiratory fitness. Those that attain the healthy fitness zone are more likely than kids in the other fitness categories to attain English language arts standards. Poverty status matters. Kids are less likely to attain those academic standards if they're living in poverty, but if they're fit, they're more likely to attain those standards than if they're not fit in both the poverty and no poverty categories. The same pattern is observed for mathematics standards, and the trends are probably even more clear for this particular academic outcome. But again, for both 5th graders and 8th graders, and in kids living in poverty and not living in poverty, it's better in terms of academic achievement to be in the healthy fitness zone category for cardiorespiratory fitness. So again, the message is the same. It's better to be fit. That associates with better academic outcomes. And that's true for kids living in poverty as well as those not living in poverty. So with that, I'll just say it's been a pleasure to work with this project over the last few years. Look forward to continuing to do excellent work in collaboration with our colleagues at DHEC and the State Department of Education and Blue Cross and Blue Shield of South Carolina. Thank you. And with that, I'll pass this back over to Bree.
All right. Thank you, Russ, for sharing that information on the data. And so earlier in this project, in this initiative, the focus really was just getting the system in place and functioning. And so now our focus is moving schools, communities, and state stakeholders towards using the FitnessGram data to drive decisions that are going to lead to improved fitness of South Carolina public school students. And so the question in a nutshell really is, how do we use the data? And so Russ really did share some good examples of how this can be done. And but before I go into more details about where we're headed with this initiative, I guess it's really important to say that, you know, we're not alone in this. Russ and I have mentioned a few partners, but we also have other partners that are helping us to get to where we're going. And so in the summer of 2020, we actually convened a core team of individuals who, okay, it's advanced, I'm sorry. We actually convened a core team of individuals and an advisory council who helped guide our implementation. And these are key health and education leaders at the national, state, and local and community levels. And the main strategies that we're focusing on are to reach our goals is to improve student health related fitness involving the communications, opportunities, professional development opportunities, as well as an intervention. And so just to talk about briefly some of these key pieces for the communication, it's really centered around us establishing a process and structure where there's an increased awareness of South Carolina FitnessGram and the importance of student fitness. And for the professional development piece, it's equipping PE teachers and other stakeholders with the knowledge and resources and skills to use this data. And I'll talk more about this when I talk more about what the communities can do with this data as well. And so finally, there's an intervention piece also. Yeah. And so for this intervention, we're actually going to be engaging a few school districts, and we are going to try to work with them to implement practices for improving school health. And so some of these practices will address, for example, increasing time for physical activity. So students, extending opportunities for students during recess or PE, scheduling physical activity opportunities before or after school. Also increasing the intensity of physical activity. So we want to see students spending more time in moderate to vigorous physical activity. Also an improvement in the quality of physical education. And so meeting PE standards and best practices, such as students being active at least 50% of the class time. And finally, trying to create a culture of health and fitness. So we don't want it to be just a one-time event, you know, health and fitness opportunities, but for it to become a norm, okay? And so all of this really ultimately to see which best practices work in the classroom and outside of the classroom that are going to impact cardiorespiratory fitness specifically for the intervention school districts, okay? And so it's important also to talk more about that creating a culture of health and wellness piece. it's important to recognize that it's not primarily the responsibility of the student and the PE teacher only. Instead, it is a collaborative effort, okay? And so this includes engaging parents, school wellness councils, administrators, and the community, which is what we're hoping to do. And you're gonna hear me say that a couple of times. And another reason, and this is also another reason why having this system in place is so important, not just to collect and manage data, but to be able to use this data, okay? And so now I wanna talk a little bit about the actual software. And so this software, it can track physical fitness scores for students, and some of the things that Russ reported on a little earlier are what that data looked like. And this also provides students opportunities to create goal settings. And this is just these for different functions in the software itself. And the software also offers ability for generating reports. So students can generate reports, teachers can generate reports, administrators and parents also. So there's a lot of potential for using this data and having access to it. And the reports are easy to generate, they're easy to interpret, and this can be done ranging from information at the individual student level. It can be class level, classroom level, it can be school level, district level, and statewide level. So it's a wide range. Okay. And so we know that data drives decisions, and this is especially important for FitnessGram as well. And so this data, it allows for opportunity for positive changes and healthy habits. Again, like I said, I would say it multiple times, for students and teachers, for the community, for administrators, and for parents. And the data also provides justification for funding grants, for policy and system changes, for professional development opportunities, and even justifying fitness equipment purchases. Okay. And with this information being accessible, it also offers opportunity for application, more application. And so school administrators, for example, can see trends of fitness levels of their students in schools over time. So this offers a picture of the health and the status of the students' health and fitness as a part of reaching school and health and wellness goals. Another example could be seeing the association between fitness and academic achievement, which is something that Russ shared a little earlier. And that's why this information is very important and meaningful in a lot of ways. A few other examples are there's opportunities to introduce changes to the school environment that focus on health and wellness. And finally, there's opportunities to foster communication between parents, teachers, students, and communities. And so this is really important, especially as it relates to health-related fitness for the students and knowing the status of that information. And so you all are probably wondering, how do we get this data as a community member, as a teacher, as anybody that's watching? And so the state level information that Russ shared, this is actually available to the public, and this can be found on our DHEC website. And I could share that link in the chat when I get a minute. I can't see the chat currently, but I'll share that with you all. But also, as far as the district level data, the local data, now this is owned by the districts. We don't actually have access at the state level. And so communities that are interested in this will have to connect with their local school districts. And a good example of this, a success story, I'll say, is Live Well Kershaw. And they wanted to know how to better support student health. And so they worked with Kershaw County school districts who shared the data with them. And they look for ways to enhance collaboration between the community and the coalition and the school district. And this was an opportunity to connect with the food service directors to serve on the district wellness committee as well. And so just another bit of information, based on the federal and state mandates, every school district should have a district wellness committee with the community members represented. And this committee supports the adoption and the implementation of the district wellness policy for healthy eating and physical activity. And so this is just one way we can use the data to support student health. District food service directors are a great first point of contact to learn more about these committees, and their contact information can be found on the district website. All right. And I'm not sure how it works. The platform is a little different, but I wanted to pose a few questions to you all. If you would like, you can answer these in the chat box, in the Q&A box. There's a couple different boxes available, I think. But I would like to know, are you or your coalition working on initiatives to improve the health of school-aged children and youth? Also, how could using this data help you with your current efforts? Okay, and finally, do you currently collaborate with your school district? And so if you are able, please share those in the chat box. And this would also transition us to a question and answer. So I'm going to stop there. Feel free to share.
Thanks, Breonna. This is Meg Stanley from Eat Smart, Move More. I will ask attendees that want to communicate with us and to be able to answer some of Breonna's questions, to put those into the Q&A. That way I will be able to see them and send them over. And if you have any additional questions, we will open the floor for questions using your Q&A button. And we'll just give it a few seconds here because we are early wrapping up. So we have plenty of time if everybody wants to think about some questions.
While everyone's finishing up questions and things, I think I transitioned really quickly. I would like to thank you all for participating in this session. This really is meaningful to our team and our partners, and we really appreciate the time that you're taking to see what we have going on with South Carolina FitnessGram. So we're really excited to continue with this work.
While I'm waiting for some of the audience to perhaps send us some questions, I'm curious, and this is, I know we at Eat Smart Be More are doing what we are able to help work with you in promoting the use of FitnessGram, and especially right now, I know there was an article that I read in the Wall Street Journal, it was either yesterday or this morning, talking about the rise in childhood obesity as a result of the pandemic and children not being at school where they're able to participate in physical activity or in physical education regularly. Has that been some of the conversation among the staff at DHEC and with you and Russ and some of your colleagues, and how maybe using some of your partners like us at Eat Smart Be More and some of the folks in the audience to really promote and spotlight the need to track this data and to see what the correlation is to following what all guidance you are able to provide?
So, sorry. So I'll let Russ start with the, I guess, the data part of that, and then I'll talk about what we've actually been communicating with our partners on this. That's a really good question, Meg.
there is I think legitimately an enormous concern that that kids will have experienced negative outcomes for not only weight status, but very likely other fitness related outcomes as well as a result of the COVID pandemic. We've known for some time that kids tend to gain more weight and lose fitness over the summer. That may seem counterintuitive, but that's now reasonably well demonstrated and accepted. And there's an argument that when kids are in the traditional, school, in-person school setting, that they are more active, and their dietary behaviors probably more controlled than may be the case when they are outside the structured school setting. So, I think that a lot of us that follow the national data as well as state level data on physical activity and fitness in children are girding for some probably fairly negative data that may be coming out regarding the impact of the pandemic. I think the take-home message is, as we phase out of the pandemic and kids and the rest of us get back into a more normal behavior pattern, that we absolutely redouble our effort to get kids as physically active as possible. I think we've learned a lot the hard way with the pandemic, and I think on the positive side, I think there's been a lot of creativity and people trying to maintain their activity and trying to maintain their kids' activity. But I think kids have missed the structure and resources of traditional in-person school. And, I think this probably heightens our awareness of the tremendous importance of the school and school programs and school-based behaviors on kids' activity and fitness and other health behaviors as well.
A question that has come through from our audience is asking you to explain again how the community members or coalitions would be able to obtain the school district data.
Yeah.
Right. And so each school district that is participating in this initiative, they have access to that data. So I mentioned it before, that the statewide information is on the website, which let me go ahead and drop that in the chat box if I can find it. I'll try my best to find it. But it's at the DHEC FitnessGram website. And so for anyone who's trying to get information on their particular school district in order to work, with community coalitions or anything like that, you would just need to contact your local school district person. So whoever is over the PE, health departments, they're all named different things. This is who you would want to get in contact with. And you can also reach out to me. I can leave my information as well. And I could connect you with that individual at that district. And so you can make those connections.
I might add that part of our job at USC each year is to provide district level summaries of the FitnessGram data, which is not made public, but those district level reports are provided back to each district. So each district does have an annual summary of the data from the kids in their district, but it is up to them to decide whether they release that information or make it public. So just as Bree said, if you're interested in getting that information for a particular district, contact the district, the district office, the superintendent's office for that request.
There's been another question sent in regarding that mental health is a big focus right now, and wondering how we can use movement and fitness as a way to help with mental wellness. And I'll add to that in that if you have any suggestions on that, I know that's the behavioral health has been a discussion with us at Eat Smart, Move More in the connection to healthy eating, active living. Is there anything specific within FitnessGram and within your research, Russ, that is including behavioral health and mental health?
Well, I will say that, independent of FitnessGram, the body of knowledge linking higher levels of physical activity to better mental health outcomes gets stronger every year. The report of the Federal Physical Activity Guidelines Advisory Committee released a couple of years ago has a major chapter on physical activity and brain health, which is inclusive of mental health outcomes. I think the field is increasingly interested in learning about and documenting important, very short-term, almost immediate health benefits associated with physical activity. A lot of what we know about the health benefits of physical activity linked to very long-term health benefits like reduced heart disease risk and reduced risk of certain cancers and diabetes and so on. And obviously that's really important, but it's also important that higher levels of physical activity provide very important and almost immediate short-term benefits in the brain health category. And I think we're learning a lot about that these days, and there'll be a lot more to disseminate about that. I wouldn't say that within our FitnessGram work there's been a specific focus on that, although the findings that I presented today on academic outcomes I do think fall into that broad kind of brain health category.
Well, thank you both for the good information today that you were able to share and for answering some of the questions that have come in the chat and through our system. And I will say thank you to both of you and also our audience